operation room of Dr. Chynn's clinic at Park Avenue, Lasek, New York, and today I will show for you equipment that Dr. Chynn is using for corneal tattoo. This is special corneal tattoo device, and here we can regulate the speed of the corneal tattoo machine, and here the button that we need to push to start a process. You can go closer and you will see this small needle, and we can regulate how deep the needle will go to the cornea. And in these bottles we have different types of ink, because we have a patient who has different color of the iris, and we can mix gray one and blue one and brown one, and dark black color we use for the pupil. This is vials where we put in ink, and when we start the procedure we just take this ink, and after Dr. Chynn will put this ink in the cornea. This is microscope that Dr. Chynn is using for corneal tattoo, and patient going on the microscope and to use the corneal tattoo machine. And every week we have more and more patients who want to get corneal tattoo, and they fly from all world in this place because Dr. Chynn, #1 surgeon who can do corneal tattoo. Thank you. Bye.
Okay, so you're here today for a cornea tattoo.
Yes.
And can you explain how you lost vision in your eye?
So I lost my vision 10 years ago.
Okay, slow down.
Yes, 10 years ago. So when I was in 15 years old, when I'm playing the games, and with suddenly the stone is hit my eye. So after 1 week or 10 days, I went to hospital, and so they checked my eye, and so it's a retina problem. So they suggested we'll go for surgery. So immediately I went to surgery. After that is the first surgery. So after six months, they said you should come back, and so again we need to done one more surgery for for my.
Okay, so we're doing a cornea tattoo. I think I'm one of 3 doctors in the United States to do corneal tattoos. I was taught by Doyle Stolting, who is a really famous cornea surgeon. He was past president of ASCRS, which is the largest organization for cataract and refractive surgeons in the world. And there are other ways to do it, which is like injecting ink or using a surgical needle. It's not as good. So we got a special corneal tattoo machine. It's got very few needles, a lot of fine control. I was telling Dr. Ash, my fellow from Lebanon, that we got special ink that's centrifuged to be fine particles. It's really just to give us more control. And this gentleman had an injury about 15 years ago. A friend of his hit his eye. Kids playing around threw a rock and hit his eye. He went blind, had a retinal detachment, and a bad scar, which is mostly, it's basically calcium. So he's getting married, and he wants to do this for his cosmetic appearance, even though he's an adult now. And we're applying brown for the iris first, okay? So we're halfway through the procedure. And we're picking up the ink here, right? So a little inkwell. And you'll see as I do it that, he's getting more brown. He started out totally white. He's got some brown going on. Now the problem is, when he's got so much calcium, it doesn't take up the ink very well. Regular cornea takes up ink better. So, when they have so much calcium, they don't get as deep a color as you would want, or you would get if you didn't have so much calcium, but it's better than nothing. And then we're going to try to do something where we get some black in there as well. You got to keep your chin up. Always keep your chin up. Like that. Just I know it's a little uncomfortable for your neck, but just try to not lock your neck like that. It's a better angle for me. It's better. So you just have to try not to perforate because, like Dr. Ash was saying, the needle's going so out that you could easily perforate the cornea. Normal cornea is about 500 microns thick, which is half a millimeter. Now with all this calcium and stuff like that, it looks like you might be 1 millimeter thick, probably. But then again, it's like a spongy, weird cornea. It's not normal tissue, so you got to be careful. Now, if we do perforate, it's not going to really affect his vision because he only saw light. It's called light perception, LP, and he did consent to being NLP, or not losing his light perception, because obviously when we put a black circle in the middle of his cornea, the better the cosmetic appearance and the more dense black it is, the worse his vision is. He's going to lose light perception. But light perception is not very useful, and the other eye is normal. Okay, so we can see if Dr. Ash got any more black out of here, and we can put a little pupil in. If not, we're going to have to come back and do the pupil. So let's see. Yeah, so Dr. Ash was able to get some black out of there, so we're going to try to put a little pupil in.
Impressions of the corneal tattoo.
Yeah, so Dr. Ash was able to get
Your
like a little bit or a lot?
Little.
A little bit? Yeah. Which part is, do you have any idea which part of your eye is hurting? Is it the white part? Is it the clear part? You have an idea?
It's upstairs.
Yeah, it's hard to know. Like, you're not really looking up. Open wide. Look up. Look, not down, up, up.
look up. Up.
More up.
With your eye. Move your eye.
Yeah,
up.
there you go. No, up, not down.
Up. There you go.
A little more up. It'll look more up.
A little more up with your eye.
You know, we want the lens to sit. Keep looking up. Up. You gotta look up, not down. Up.